Its 75th anniversary was celebrated on Wednesday, but the National Health Service is not doing well. Doctors and patients say the Conservative government is deliberately allowing it to degenerate. So the 75th anniversary of the National Health Service, the NHS, was celebrated in London on Wednesday with a Thanksgiving service in Westminster Abbey with hymns and processions. It's only appropriate, say many who have seen the National Health Service as heroes of the pandemic. But the facade is extremely deceptive. Not just because the British have a love-hate relationship with the text-financed service, as the BBC commented. Rather, the Jubilee has long been in the intensive care unit itself, and the care is becoming increasingly difficult. However, most doctors and nurses don't feel like celebrating at all. A week after the anniversary, almost 48,000 junior doctors in England want to stop work for 5 days. It would be the longest strike in the history of the NHS, and yet just another highlight in months of industrial action by doctors, nurses and paramedics for better pay. According to the NHS, more than 650,000 surgeries and doctor's appointments have had to be cancelled since the strikes began last December. More than 7.4 million Britons are waiting for treatment in the completely overburdened hospitals. In addition, on July 20th and 21st, chief physicians and other doctors in leading positions want to stop work for initially 48 hours. The British Public Health Service is a respected institution on the island, and even Margaret Thatcher's Chancellor of the Exchequer, Nigel Lawson, once sneered at it that as the closest thing to a religion in England. Launched by the then Labour government in July 1948, the NHS proved to be one of the greatest achievements of British social policy. Financed by taxes, it was and is freely available to all citizens, and nobody who needs advice, care or treatment has to pay for it. In founding the NHS, Labour wanted to give post-war healthcare a fair footing, and the popularity of this principle also prompted Conservative politicians to protest that the NHS was untouchable and that it was in safe hands with the Tories. Of course, not all Britons are sure of that anymore. The British Medical Association has accused the government of wanting to deliberately destroy the National Health Service. Philip Benfield, chairman of the association, said most doctors and nurses he spoke to believed the Conservative government was deliberately letting the NHS degenerate. I would be surprised if the NHS survives the next 5 or 10 years in its current form. Many staff and patients share Banfield's pessimism. According to the unanimous opinion in the country, the situation in the NHS has never been so critical in its history. And as I said, around 7.4 million people were waiting for routine care in April. That's more than ever before. And almost 3.1 million of them were on the waiting list for longer than 18 weeks, the maximum time specified. 371,000 have even held out for more than a year. Prime Minister Sunak had promised to significantly reduce waiting times. Since then, however, the number has risen to a record high. As of now, Sunak has failed, as with so many announcements. Even in emergencies, it takes significantly longer than specified for an ambulance to arrive. Many Britons know horror stories where, for example, elderly people had to spend a day on the ground after a fall before help arrived. Just 29% are satisfied with the NHS, as a spring survey found. That's the lowest since service began 40 years ago. It was very different in 1948. The euphoria was tremendous then. The only thing that wasn't asked for was a glass eye, said one doctor on day one. The then King, George VI, also made a public statement with his family and thus also his eldest daughter, the future Queen Elizabeth II. And former Treasury Secretary Nigel Lawson once said, I said that before, that it's close to a religion. And the service provides healthcare to every UK resident, both through general practitioners, known as GPs, and in hospitals. Every man, woman and child can use it, the government advertised at the time. There's no age limit and there's no cost. The NHS was the pinnacle of the welfare state and is now, for many, the symbol of broken Britain when nothing works anymore. And I mentioned the strikes earlier. There have been labor disputes in many sectors since last summer. Because of the rapidly increasing cost of living, employees are demanding higher wages on the railways, the Royal Mail, in authorities, and also in the NHS. For the first time in their history, medical unions called for a strike. And with around 650,000 appointments and surgeries that had to be postponed as a result, the fronts are still hardened in some areas, and shortly after the NHS anniversary, the doctors will go on strike again. And that's something that also has never happened before. The loss of trust between the government and NHS forces is at an historic high. That is something else Banfield said. And it is a farce that the doctors see no other option than strikes. The working conditions are becoming increasingly difficult, but there is no more money. This is another reason why many professionals are leaving the NHS. Many EU workers have already left because of Brexit, and according to government information, 112,000 employees are missing in England alone. And as I said, Sunak now wants to revitalize British patients with a major reform. More than 300,000 additional doctors, nurses, and other employees are to be hired over the next 15 years. And changes in training are also planned, but we haven't seen much of that. The measures are unlikely to take effect until the next parliamentary election, which are planned for 2024. So that's not good prospects for Sunak's Conservative Party, which is still well behind in the polls. Even in 1948, not everyone was euphoric. There will be no miracle when the new health service starts on July 5th, was said by John Edwards, the then Health Secretary's right-hand man. There are many outdated buildings, there is lack of equipment and staff, and there will be 60,000 beds that cannot be used because there are not enough caregivers, said 1948. It's almost as if the NHS hasn't progressed a step since its inception. However, privatization as a solution is out of the question. 90% of Britons want the offer to continue to be available free of charge for everyone. In retrospect, experts blame the austerity policy under Tory Prime Minister David Cameron after 2010. While the Labour governments of Tony Blair and Gordon Brown increased the health budget by an average of 6.7% per year from 1997 to 2010, Cameron and his successor Theresa May reduced this rate to 1.4% from 10 to 18. The number of missing doctors and nurses quadrupled or quintupled during this time. Boris Johnson raised the quota a bit under the impact of the pandemic. This year, however, it has slipped back to 1.2% under Prime Minister Rishi Sunak. And according to surveys, most Britons fear that they will soon be asked to pay as patients because the government wants to continue to economize, and Sunak would like to do something good for the private sector. 1 in 8 respondents say they have gone to a private doctor after waiting endlessly for an NHS appointment because they needed urgent help. However, 72% of the population are convinced that the NHS needs better financial resources in order to be able to fulfill its central task again, and that it should continue to be freely available to everyone. I just wanted to give you a quick reason to let it all go down, because if we have the same situation in the NHS as it was in 1948 when it was founded, something is definitely going wrong. We have a lot of discussions in the German health system as well, especially in rural areas where doctors don't want to go and stuff like this. And our Social Democrat health minister made some very stupid remarks recently that have shaken kind of everyone working in health services. And I just wish he will not do his plans. But nevertheless, the NHS is a big problem. I have the direct comparison. I've been living there, and of course, while I was living in the UK, I got sick. And the NHS was quite, well, what should I say, an experience. I was used to the German health system. And we do have criticism on the German health system. But it was worlds apart from the health system I experienced in the UK, to be honest. And I'm glad that when all this long COVID stuff hit me, that I was here in Germany and not in the UK. I'm sorry. And there needs to be something needs to be done quickly and decisively. And it must be worse now than at the time when I was living there. That is what I'm afraid of, and what people tell me. They don't have the comparison with Germany in most cases, but it is a serious problem, and that I know not as many people will watch an NHS video as a Brexit video, but this is an important topic, and that's why I chose to talk about this topic, especially with the anniversary this week. And we need to talk about it, and people have to be aware that in other places that it's not like in Germany, for example. My German viewers are living in a kind of a winter wonderland compared to what you experience nowadays in the NHS. But we might talk about it a little bit more on Sunday on my next live stream at 6 p.m. CET. If you haven't known yet, the live streams are back, finally. I wanted to do that for quite some time, and it's already on the channel page, the announcement of the next live stream, so you can have a look there as well. And if you want to have a look right now, the next video is here on the end screen. I'll see you there. I'll be back.